Did you know that your body can actually send out warning signals days or even weeks before a stroke happens? Stroke is now one of the leading causes of death worldwide. What makes it especially dangerous is that although the symptoms may strike suddenly, many people don't realize something is wrong until it's too late, sometimes hours or even days later. A stroke is a medical emergency because when blood can't reach a part of your brain, that area becomes deprived of oxygen and nutrients, causing thousands of brain cells to die every second. What's even more alarming is that heart and vascular problems are on the rise, especially among younger adults. There are certain warning signs you should never ignore, even if they seem minor. Many of these symptoms can appear very early, sometimes even a month in advance, but are often misunderstood or dismissed. That's why learning how to recognize these signs is absolutely critical. If you notice any of the symptoms mentioned in today's video, don't wait, get checked right away. These could be your body's way of sounding the alarm before a stroke strikes. In today's video, you'll discover 10 early warning signs your body may give before a stroke, and more importantly, how to protect yourself so you don't become another number in those frightening statistics. Sign number 1. Unusual exhaustion. Feeling extremely tired, for no clear reason, can be one of the earliest warning signs of an impending stroke. Of course, fatigue can be caused by many things, but if you experience a kind of deep, lasting exhaustion that feels different from the usual tiredness from lack of sleep or overwork, it could be something more serious. This type of exhaustion is often linked to changes in blood flow to the brain. It may happen when a blood vessel becomes narrowed due to plaque buildup or when a clot disrupts the delivery of oxygen to your brain. So, if you find yourself unusually drained and can't figure out why, don't ignore it, get checked by your doctor right away. It could be your body's early signal that something's wrong. Sign number 2. Sudden vision problems. Any sudden change in your vision could be an early warning sign of a stroke. This may include double vision, blurry eyesight, difficulty seeing out of one eye, or trouble focusing. These symptoms often point to problems with blood flow to the brain. In some cases, vision loss can happen when a blood vessel that delivers oxygen to the eye becomes blocked. While eye issues can come from many different causes, unexpected changes in your vision should never be ignored. Getting checked right away is crucial to determine the exact cause and possibly prevent something far more serious. Sign number 3. Severe dizziness, loss of balance, or coordination problems. Be especially alert if you suddenly feel intense dizziness, the kind that makes it seem like the room is spinning, or if you unexpectedly lose your sense of balance or control over your movements. You might find yourself stumbling, unable to walk in a straight line, or struggling with simple actions that usually require no effort. While these symptoms can be caused by various conditions, when they come on suddenly and without a clear reason, especially if paired with other stroke signs, they should never be ignored. This isn't just a passing, lightheaded feeling. It could signal damage to areas of the brain like the cerebellum, which controls balance and coordination. If this happens to you, seek medical attention immediately. It could be your body's urgent call for help. Sign number 4. Sudden confusion or trouble understanding others. Another serious warning sign beyond slurred speech or difficulty speaking is when someone suddenly becomes confused or can't understand what others are saying. They may seem disoriented, unable to follow simple instructions, or have trouble keeping up with conversations they normally understand with ease. This isn't ordinary forgetfulness, it's a sudden and noticeable change in the ability to process or understand information. It may be a sign that the areas of the brain responsible for language and comprehension are being affected. If this happens, don't wait. It could be a critical sign that a stroke is already in progress. Sign number 5. Other unusual neurological symptoms. In the days or even weeks before a stroke, whether caused by a blockage or bleeding in the brain, some people may experience strange neurological symptoms that don't seem typical. Sudden memory loss, unexplained nausea or vomiting can sometimes be early red flags. In other words, these signs might show up well before the actual stroke hits. However, it's important to understand that other conditions can also cause similar symptoms, such as seizures, low blood sugar, brain tumors, severe anxiety, or infections affecting the nervous system. That's why you shouldn't delay. If you or someone you know experiences these unusual symptoms, see a neurologist or healthcare provider right away for a thorough and accurate diagnosis. Sign number 6. Transient ischemic attack. TIA, also known as a mini stroke. Sometimes a brief spell of dizziness or other strange symptoms could actually be a transient ischemic attack, or TIA, commonly called a mini stroke. A TIA causes symptoms that mimic a real stroke, but they only last for a short time, usually just a few minutes to a few hours, and then go away completely without leaving permanent damage to the brain. This happens when blood flow to a part of the brain is temporarily blocked. Even though the symptoms may disappear on their own, a TIA is not something to ignore. It's a serious warning sign that a full-blown stroke could be just around the corner, sometimes within days or weeks. Ignoring a TIA because the symptoms passed can be extremely dangerous. If you ever experience something like this, call 911 or your local emergency number immediately. Quick action could save your life. Sign number 7. Numbness or weakness in the arms or legs. If you suddenly feel numbness or weakness in your arms or legs, especially if it happens on just one side of your body, it could be an early warning sign of a stroke. This often affects one side of the face, one arm, or one leg. You might notice that one side feels heavy, hard to move, or completely numb. These symptoms can come and go quickly, lasting just minutes or a few hours, but they should never be ignored. Even if the cause turns out not to be a stroke, it could still point to a serious neurological issue that needs medical attention right away. Don't wait and see, get checked as soon as possible. Acting fast can make all the difference. Sign number 8. Speech and language problems. Aphasia. One of the key warning signs before a stroke can be sudden trouble with speaking or understanding language. A person may start to slur their words, speak unclearly. A condition known as dysarthria, or struggle to find the right words to express their thoughts. They might also have difficulty forming complete sentences or understanding what others are saying. These language disruptions, including trouble speaking, comprehending, or organizing words, are collectively known as aphasia. If you or someone around you experiences this kind of sudden communication difficulty, it's a red flag that should never be ignored. Immediate medical attention is essential. Sign number 9. Sudden severe headache. A sudden and intense headache can be an early warning sign of an upcoming stroke. While not all headaches are related to strokes and not every stroke involves a headache, this type of pain should never be taken lightly. In ischemic strokes where blood flow to the brain is blocked, the headache may result from the restricted blood supply. These headaches often come on very suddenly and are described as extremely painful. In cases of hemorrhagic stroke, when bleeding occurs in the brain, the person may experience a powerful headache due to internal bleeding. Some people describe it as the worst headache of my life. A severe headache can also signal that a brain aneurysm is about to rupture. This is a medical emergency and must not be ignored. If you ever experience this kind of intense, out-of-nowhere headache, seek immediate medical help. It could save your life. Sign number 10. Uncontrolled high blood pressure. If your blood pressure stays high over time and isn't properly managed, your risk of having a stroke rises significantly. Blood pressure is the force of blood pushing against the walls of your arteries. When that force is too strong, it's called high blood pressure or hypertension. Over time, this constant pressure can damage your blood vessels, making them weaker, narrower, and more prone to rupture. If a blood vessel in the brain bursts due to high pressure, it can lead to a hemorrhagic stroke where bleeding occurs inside the brain. On the other hand, if high blood pressure damages the arteries that supply blood to the brain, it can block blood flow and cause an ischemic stroke. That's why knowing your blood pressure numbers and keeping them under control is so important. If you have high blood pressure, take it seriously. Stick to your prescribed medications and make healthy lifestyle changes. Keeping your blood pressure in check is one of the most powerful ways to prevent stroke and protect your heart. Now you will understand that when blood flow to the brain is disrupted, it can bring you dangerously close to having a stroke. Other factors such as heavy alcohol or drug use, being overweight, an unhealthy diet, depression, anxiety, and lack of regular exercise can all raise your risk. These triggers can set off internal reactions that over time increase the likelihood of a stroke. The important thing to know is this: in many cases, strokes happen without any clear warning signs. That's why prevention is key. Keep your blood pressure in a healthy range, maintain stable blood sugar levels, and aim for at least 150 minutes of physical activity each week. Even simple walking makes a big difference. Eat fresh, nutritious foods, avoid heavily processed items, and limit your intake of sugar and saturated fat. Also, be sure to monitor your cholesterol and schedule regular checkups with your doctor, especially a cardiologist. Always remember, managing risk factors like high blood pressure, diabetes, and quitting smoking are crucial steps to protect your brain. If you found this video helpful, don't forget to hit the like button and subscribe to the channel. Share this information with your loved ones so they can take better care of their brain health too. And most importantly, if you or someone near you shows any of the sudden signs we mentioned, call emergency services right away. When it comes to stroke, time is everything. See you in the next video.